Hi, this is Teresa Pablos, editor-in-chief of drbicuspid.com. I am so excited to once again be speaking with pharmacologist extraordinaire Tom Viola. Today, we're talking about Carbocaine on the latest episode of Dental Dose. Thanks, Tom.
Good to see you again. How's everything? Okay?
Good. Everything is good. You may notice my background's a little different. We're in the middle of moving, so that's why there's been a little delay in some of these new episodes. But I'm so excited to be talking with you again. And this time we're continuing our local anesthetics, myths, things you may not know. And the next one up is Carbocaine.
Good old Carbocaine, yes.
What do we need to know? Give us the 411, although I don't know how many people say that anymore. But give us the 411, Tom.
I still say it. So Mepivacaine, or Carbocaine as it's most widely known, although it's also called Polocaine, has a few other different brand names. But Mepivacaine, Carbocaine, is an interesting subject to talk about because Carbocaine has always had this reputation in dentistry as the safe anesthetic to use when you weren't sure about whether or not to use epinephrine. So if you look at the ones we talked about so far, we talked about articaine and what most commonly known as septicaine, and that is only available with epinephrine. Then we talked about bupivacaine, which used to be known as Marcaine, and that's only available with epinephrine. And then we talked about lidocaine or xylocaine, and it's only available with epinephrine. So by the time we get to talking about mepivacaine, it's like, oh, finally, a free epinephrine-free anesthetic. No epinephrine required, no epinephrine to worry about. You can give it to patients who have any kind of sensitivity to epinephrine whatsoever. And that's great. And that's exactly what mepivacaine is. It is the epinephrine-free anesthetic agent that's most widely used in the United States. And it stops there. Most people just think, well, that's the best part about mepivacaine.
That's it. That's all you need to know.
Right? It's done. That's it. Carbocaine plain. Done. What else do I need to know? But there's actually a lot more to it. First of all, what makes mepivacaine stand out over some of the other anesthetic agents like lidocaine is that it's actually stronger. It's 3% versus lidocaine being 2%. So it has 1.5 times the number of molecules per cartridge that lidocaine does. And therefore, more molecules means, more to get the job done.
All right, let's see if I remember from our previous episodes. More molecules means it lasts a little longer, which means it's better for longer procedures. Is that right?
Yep, and it penetrates the tissue better, and then so you get greater efficacy and greater or more profound anesthetic effect because you've got more molecules doing the job. So that's awesome. Now, okay. At the same time, it is available plain, so we know that. But what does it mean to just be plain? The point of that is why mepivacaine shines is without the epinephrine, there's less acid in each cartridge. See, in order to make epinephrine stable in an aqueous solution, you've got to add acid to keep that epinephrine from falling apart. And of course, we had bisulfite as a preservative, but you have to add acid as well. So now, since mepivacaine is plain, no epi, we don't have to add as much acid, so the pH of the cartridge is higher, and there's no sulfites. So if a person has a sulfite allergy, it's not a consideration. Wonderful, okay? But it goes even further than that. Because the cartridge has a higher pH, when you're injecting mepivacaine into the tissue, you're not bringing all of that acid to bear. You're not lowering the pH of the tissue as much as if you would if you added all that acid. So now, by adding mepivacaine, it's less acid, less lowering of the tissue pH. So now, if you would add another cartridge of either mepivacaine or another anesthetic agent, let's say lidocaine, that anesthetic agent would work faster and quote unquote better because the pH of the tissue is not as low as it would have been had you used a cartridge that contained epinephrine and therefore more acid to begin with. So mepivacaine is a great agent for what we call piggybacking, where you can use one anesthetic agent and then piggyback another one on top.
I'm curious, how is that common for dental anesthetics, or is that pretty unique to Mepivacaine, Carbocaine?
So a lot of docs and a lot of dental professionals use, hygienists, surgeons use Mepivacaine as a starting agent, as a sort of launch pad to piggyback another anesthetic agent on. For example, you may love Mepivacaine because again, 3% more molecules, no epi, less acid. But the downside of Mepivacaine is without the epi, it doesn't last very long.
Hmm.
So what some clinicians do, hygienists, dentists, oral surgeons, start with Mepivacaine, right? Why? Okay. First of all, no epi, less acid, right? So it's a more comfortable injection. Don't forget when you, as we talked about last time, when you inject acid, that's that burn that people say, ow, that burns, right?
Hmm.
That's the acid having its effect on the tissue. So it's a more comfortable injection, gets the patient numb pretty rapidly. And then in the midst of that, you add the second anesthetic agent, let's say with epi, and now you get the profound effect you're looking for by combining the two anesthetic agents.
So it's really it can stand on its own, but it's also really good for complementing other agents.
Exactly.
And so I keep waiting for the but though. Like this is good for like these patients with allergies, but so let's go. Like who might not benefit from Mepivacaine, or is it just magic unicorn agent that really does work for pretty much everyone?
So what's the but? Well, I'll get to the but already. I get it. So, okay, one more positive before we get to the but, right?
Oh, I'm sorry. I'm
No,
jumping.
no,
I'm
no,
jumping.
it's related. It's good. It's all good. It's related. I'm glad you brought it up. So it's 1.5 to 2 minutes onset, which is freaking awesome when you think about it,
That is
because,
really fast.
right, patients walk into your operatory with I would say, an expectation of what? The minute you retract that needle, instantaneous anesthesia, right? And the longer it takes for the anesthetic effect to kick in, the more they're looking at you like, you know what you're doing?
Okay,
Why is
I've
it
got
taking
stuff to do.
back? Why is it taking so long? If it's taking so long, maybe you didn't do something right. And if you didn't do something right, then later when I really need the anesthetic, when you're in there doing your job, I'm going to feel breakthrough pain. So, it's all like a thought process. Okay, so 1.5 to 2 minutes from Mepivacaine means what? It basically delivers on the promise. Like you're numb pretty quickly, which is great.
Mhm.
And that's the downside. The downside to Mepivacaine is it's fast acting, right?
Mm.
But it's also short lived. Mepivacaine's greatest claim to fame is it's plain, and its greatest Achilles heel is it's plain. So without the epi, you don't really get very far with Mepivacaine. Maybe 30 to 40 minutes, maybe longer sometimes, but usually not much longer than that. And so while it's wonderful not to have the epi, without the epi, the profound effect is not as great.
So, say you have a patient that can't have anything with epi, you're reaching for the carbocaine, but it is short acting. What do you do? Do you just keep doubling up? Like, I imagine that's probably not the ideal solution. Is there another kind of solution?
So if the patient cannot tolerate epinephrine and or sulfites, you really are stuck with the Mepivacaine.
All right.
But remember, epinephrine is a wascally wabbit because you make it. So here's the conundrum, okay? You're using Mepivacaine, and so you want to use something that's epinephrine-free, which is fine. It only lasts about 30 to 40 minutes. So what happens if the procedure lasts longer than that? Well, then the patient sees you approaching with the needle in your hand saying, guess what? I have to give you another injection because the anesthetic's wearing off. Now, the first reason we have to give a second injection is because the patient's already feeling, right, sensitivity.
Mhm.
So that charges the patient's system like, hey, I'm feeling pain. That's a shot of epinephrine from their adrenal glands. Okay. So
Mm.
they're getting that surge of adrenaline. Okay. Then you come at them with the syringe. Oh, it's time for another injection. That's another surge of adrenaline. Okay. And then the actual injection itself, while it may not be painful, just the fact that you're sticking a needle in a most sensitive part of the body, that's another shot of adrenaline. So when docs say to me, I want you to use Mepivacaine, or medical doctors or whatever say, I want you to use Mepivacaine because it's plain and there's no epi, I kind of chuckle to myself thinking, the whole process of being in a dental chair causes epinephrine. Your patient's basically swimming in epinephrine the whole time. So what's a little amount of epinephrine in the cartridge really going to do? You could make the argument that it's like the match on the pile of dry grass. Like
Mhm.
that one little shot of epinephrine may have done more by kind of uh, causing the whole system to react. But I think it's kind of mute at this point. I think at the end of the day, the patient is getting epinephrine anyway. So the little epinephrine that we use in the cartridge really isn't that consequential.
Very fascinating. Well, thank you so much, Tom. Thank you for the overview of Mepivacaine slash Carbocaine. So I think to summarize it, if I have it correctly, really great as a secondary agent. Let's springboard where you can inject it first. Short acting, so you can use it for patients who can't have epi, but patients already probably have epi in their system. Anyway, is that correct? Did I
There's
get
there's there's a
everything?
there's a footnote I wanted to leave as the
Oh, footnote.
cliffhanger.
Okay, what is the footnote?
So the footnote is that two things actually. Number one, mepivacaine is available with a vasoconstrictor. You can find it. It's not epinephrine. It's levonorepinephrine, which causes more alpha blockade than beta blockade. So that means what? I'm sorry, more alpha stimulation than beta stimulation. So that means you don't get as much of this, but you do end up getting potentially higher blood pressure
Okay.
because of the stimulation of the alpha receptors. And the other problem with that, of course, is when you add the levonorepinephrine, it goes from 3% to 2% on the mepivacaine side. So you've lost a full percent of concentration with mepivacaine, and that's not really doing us any favors. So it's no wonder that 2% mepivacaine with levonorepinephrine is sort of like a unicorn. It's kind of hard to find. So some offices carry it. The other thing is that if you believe that mepivacaine is indeed a safe anesthetic agent, of course it is safe, but remember, it's one of the most difficult to metabolize anesthetic agents. So if you think about who might benefit from no epi, maybe children or maybe older folks and geriatric patients, the problem with that is if you use mepivacaine, thinking, well, it's safe because there's no epi, the fact that it's so difficult to break down, when you give it to a patient like a pediatric or geriatric patient who already has difficulty breaking medications down, that can be problematic as well, especially in high doses. So just a word of caution to people out there that mepivacaine is a great drug, don't get me wrong, but you need to be cautious in who you administer it to, thinking if epinephrine-free is safe, that's not always the way it works.
That is a really important footnote. And again, with all of these local anesthetics we've been talking about, there's pros, there's cons, there's people who it'll work better for and people then not so much. So if you at home are watching and are interested in learning about local anesthetics, I'll make sure the related reading has links. Like Tom had mentioned, we've talked about lidocaine, articaine, the one that I struggle with saying, Mepivacaine. And we're gonna have an upcoming episode on prilocaine, so definitely check those out. Thanks again for speaking with me, Tom, and I'll see you on the next
Always a
episode
pleasure.
of Dental Dose.
Thanks so much. Always a pleasure.